Hello friends, welcome to Creative Medicine. In this lecture, we will learn about not seen in saltwater drowning is. In saltwater drowning, you see progressive hypovolemia, there is circulatory collapse and pulmonary edema. Hyperkalemia is not seen in saltwater drowning. In saltwater drowning, here water will So if you see, this is the alveoli. Inside the alveoli, there is more salt water. So that means there is more osmolarity is more inside the alveoli when compared to the blood outside. So as a result, the because of increased osmolarity in the alveoli, the fluid or water will flow from the external, from the blood into the alveoli. So because of that, the fluid in the blood decreases, resulting in hypovolemia. So the fluid in the alveoli increases, causing acute pulmonary edema. There can be circulatory collapse because of hypovolemia. This is responsible for circulatory collapse. Then, actually, in salt water drowning, because of this, there will be if you see in salt water drowning, if this is the cell, okay, because the fluid and here there is increased osmolarity because of the if you see, this is the alveoli, this is the pulmonary cell, okay, pneumocyte. Okay, this is the alveoli. In the alveoli, there is salt water, so osmolarity increases in the alveoli. Whereas in the cell, there is less osmolarity is less than that of alveoli. So as a result, osmosis goes from in osmosis, solvent or water goes from less concentration to more concentration. So as a result, water moves out, so the cell will shrink. So because of shrinking of cells, there will be decreased potassium, hypokalemia and hypernatremia. So there is in seawater drowning, there is hypokalemia, not hyperkalemia. Thank you and thank you for watching.